Hi guys, my name is Andre. I'm one of the ICU nurses, and a couple years ago I developed this nice report sheet, and it's been going through many updates thanks to all my fellow friends who I work with in ICU, and I get a couple requests to explain how this tool usually works. So this is going to be a short video just explaining all the small pieces of this little document. Okay, so whenever I'm updating it, you will see a date right here, and it looks like that's been updated just a couple days ago. So right here you're going to write a room number, usually this area, fitting patient label, standard label. Right here on the top you're going to put a date, today and tomorrow. This sheet is developed for 2 days for the one ICU patient. And right here you're going to put the names of the nurses who gave you a report. If patient is a readmission, you will write right here date and possibly diagnosis. And if patient transferring out to the intermediate care, progressive care, med tele, or hospice, you will put a check mark right here. Right here in the middle, you put your diagnosis for this patient. Let's see, your hospitalist name, your consulting physicians, and intensivist, if intensivist involved in the ICU care for that patient or not. Right here you will see patient code status, full, DNR, DNI, modified, all the possible isolations, precautions. Right here you can list your allergies or no allergies, code word for HIPAA protection information, any family members. And right here you'll see all the protocols that your facility using, if it's a code cool, sepsis, DKA, CCM, withdrawal, all different times, and if you're using any restraints, safety sitters, telesitters. And if you see a little box like this is usually a Q 2 hours documentation or checks that at this end of the shift I usually cross, make sure I document it, restrain every 2 hours per hour policy. This area for this situation you usually describe what happened to patient, any updates goes in here. Right here, history of patient medical history, and if they're using alcohol, tobacco, and drugs. Right here your lines and all other access that you have for patient. Usually right here the area for patient weight and kilograms. And then those boxes go, each one explains each system. So respiratory system, we have if patient any oxygen like a nasal cannula, mask, or room air, high flow, optiflow, trach, BiPAP. You can write down lung sounds right here. If patient has a chest tube, of course, explanation here. Right here you have your blood gas with the normal values. This is for my facility where I work. And if patient using any home oxygen. If patient intubated, you have an intubation date, extubation date, size of the tube, and distance. Right here you have your vent settings, FiO2, PEEP, respiration rate, and tidal volume. Depend what kind of vent mode you're using at that time. And right here again, little boxes that make sure you document your oral care for this day and for the next day. Neurologically, patient following command, yes or no, alert oriented, your RAS, your CIWA, your pains, and you can write down anything else you're using for your assessments. Cardiac system, right here your heart rhythm and rate, your blood pressures, your EF, if patient had an echo done, any swellings. Right here your any markers for heart damage, your PTINR, PTT, and anti-10A, and right here you have your hemoglobin and platelets, also with normal limits. Any VTE for the patient, if you're using any kind of compression devices like SCDs, medication that patient is given to prevent any blood clots, and any home use and any anticoagulations. Okay, GI wise, so you have if patient has dentures, last bowel movements, any possible tubings that you can have a patient for GI area. So OG-NG, DIPOF, J2, PEG, and right here you have your outputs, basically stoma and fecal, external or internal device. Tube size, and the distance located, and if it's clamped, that's NG or geodiaph, or it's a suction, intermediate or continuous. Diet that patient has, and outputs. Usually you write down here for day or for nighttime how much patient got out from any of those devices. If patient getting any enteral nutrition, you'll write your formula right here, how fast it's going, water flushes, and how often. Diabetes. This is how often you check, Q 1 hour, Q 12 hours, or ACHS. We're using glucometer as a main software to control our sugars in our patient. Maybe your facility is using surveillance or sliding scale. Check 1, anion gap, and the A1C. Those are usually used for your DKA patients. Right here you can write your blood sugars through the shift, day 1 and day 2, and how much basal lentus. It just gives you an idea how severe is the patient status. Okay, urinary wise, if patient voiding by himself, using external catheters like a condom cath or PureWix, depends what your facility is using, or Foley catheter. It's a Foley, you will put your date inserted and size. Right here you can write your outputs, and of course BUN creatinine to monitor urinary system. Musculoskeletal, usually our patient get turned or under continuous rotation. I think I click out of the window. Or you turn them or they're able to ambulate. Skin-wise, if skin within normal limits, you will click right here. If patient has any pressure ulcer or any post-surgical, you will describe here. If patient getting bath, usually it's in the evenings or during the daytime, if it's a CHG bath. And of course, if patient has any wounds, you will document your wound care right here. Okay, and the lower section. So right here you will write your medication, if patient takes whole meds or crashed, any drips that you have for the patient for current time, any scans that have been performed, X-ray, CAT scan, MRIs for this patient, labs, and some units collect by themselves. Some have a lab coming, phlebotomist to collect the unit for them. You can check mark right here. Those are your common electrolytes, and if you're doing any replacement, you can write them right here. Any plans and procedures for this patient. Right here you gonna have your consults, so PTOT, speech, palliative hospice, case management, your little discharge planning. And right here, if patient had sepsis, usually we'll write right here. NICOM, we're using NICOM machines to measure patient fluid responsiveness, and we will document our delta change right here. You might use invasive devices to document those. You can adjust this box just writing around it. How much fluids was given in emergency department, if antibiotics started, white blood count, lactic, procalcitone, and temperature, everything related to sepsis. And right here you're going to have your cultures, of course, the most current one. And then we go into blood cultures, respiratory culture, if patient get a bronch done, bronch cultures, urine culture, wound cultures. And down the bottom, also you crossing SU documenting. If you did an admission, if you did your EKG or strip, if you did your first, second, third assessment for ICU patient, your care plans, your education, your protocols, and intakes and outputs. Usually at the end of the shift, I'm making sure I check all of this. So I'm going to go quickly to just a sample that I made. This is, please don't judge me, nothing correlates here clinically. This is just to make a feeling how it usually looks on a real world. So patient looks like patient John Smith, admitted on a 7/4. This is his date of birth. For respiratory distress, aspiration pneumonia, atrial fibrillation, and sepsis. Patient looks like we have a readmission, have been in hospital for the same in the last months. We have a Dr. Patel here. We have a consulting cardiology, probably because of AFib, and intensivist involved in the care. Report was given from Sarah, nurse night shift, and right here we have a today date. Patient is looks like DNR DNI, but they made him okay to intubate for this stay. I guess patient is intubated. Patient in isolation for MRSA. We have aspiration and fall precautions, no allergies. We have a code word the family established. We have a wife, her name and her phone number. And it looks like that patient came to emergency department with complaints of shortness of breath for 1 week, have been placed on the BiPAP and steroids, and it looks like patient have been intubated. Patient have a history of COPD, CHF, diabetes type 2, stent in 2015, atrial fibrillation, and still smoking half pack a day. 20 gauge on the right AC, right upper arm PICC line. Weight of the patient, this is blood gas, pretty acidotic. Patient have been intubated on the date of admission. This is our tube size. This is our vent settings right here. I marked for myself to document for all care and vent mode. Patient not following commands, RAS -3. Pain goes by CPOT chart. Cardiologically, AFib. Blood pressure is good. EF is 30. Patient on an NCD and Lovenox at home is using Eliquis probably for AFib. We have upper and lower dentures for this patient. Last bowel movement was on a 4th. Patient has an NG size 16 at 55. Intermittent suction. Patient is NPO. Overnight had a 200 out. Patient also diabetic. We checking sugar every 4 hours. Sugar has been 180, 116. That's how much insulin was given per sliding scale. 19 of Lantus, probably once a day. Patient has a Foley catheter placed on the date of admission. We have size and how much was getting out. Right here, patient on a continuous rotation. Patient skin looks okay. Get a bath during the nighttime, right in the morning, CHG bath. Patient getting antibiotics, Lasix, and steroids. We're crushing them probably because of NG, or it doesn't make sense because patient getting on a intermittent suction, so disregard that. So patient getting propofol and fentanyl for sedation, X-ray showing pleural effusion, CAT scan showing right lower lobe pneumonia. We're collecting blood through the probably PICC line. Those are our electrolytes. Looks like potassium a little below, getting replacement with a 60 of IV potassium. We're planning to extubate patient tomorrow. PT, OT, and speech involved. Patient probably going to go home discharged. With a septic presentation, patient had a NICOM of 5, so not fluid responsive. Get a 3 liters of fluids probably in emergency department, and antibiotics started in ED. White blood count was a little bit up, lactic slightly up or normal temperatures. Blood cultures and respiratory culture has been done in emergency. Okay, and let's go. We're going to the second day, day number 2. Looks like overnight. This is second day. We got a report from Paul, and Paul said the patient had a run on VTAC, solved result. He passed breathing trial. He's ready to be extubated. We got a new line, and we usually use a different color of pen just to see changes from the previous day. Looks like blood gas looks better. They went down on oxygen demand and pressure. So this is yesterday. I documented that I did oral care, and oral care for 2 days. Patient alert, I guess, if he's on a less sedation. RAS 0 to -1. Patient get a less propofol 10 and less fentanyl. This is output for the Foley. No changes here. Patient had a bowel movement. Through the suction, I get expected amount of output. The same sugars. Again, patient get a bath. Okay to extubate. Looks like everything looks normal. Electrolytes looks good. White blood count decrease. Lactic decrease. Had a little spike of fever. Okay, guys, if you have any input, any suggestions, please let me know. I sell through Etsy, and I'll put a link below. You can find those sheets on Etsy. And if you have any suggestions, I think this is a mutual work of all ICU nurses, how to get a comprehensive, concise, and the best report we can, and because of our patient, we're doing this. So thank you so much, everyone. Have a great day.